In this video, we're going to talk about heart failure. But before we go into that, it's important to understand the most basic anatomy of the heart. In humans, we have a four-chambered system. 1, 2, 3, and 4. We have two atrium, a left and a right, and we have two ventricles, a left and a right. The atrium are responsible for bringing blood into the heart and then sending it to the ventricles. From there, the ventricles pump the blood out of the heart to a specific destination. Blood with low levels of oxygen comes into the heart from the body. It enters into the right atrium. The right atrium then pumps the blood into the right ventricle, and from there the ventricle pumps the blood out of the heart towards the lungs. The blood picks up oxygen from the lungs as it passes by. It's a short journey because now the oxygen-rich blood returns back to the heart via the pulmonary veins. When entering the heart, it again enters through an atrium, but this time it's the left one. Like on the right side, the left atrium pumps the blood into the left ventricle. From there, the left ventricle can pump the blood to the rest of the body. After passing through the body, the blood returns to the right side, and the process repeats every day, every minute, every second until the day you die. Now that we've grasped the basic function of the heart, we can discuss heart failure. Simply, it's the heart failing to pump a sufficient amount of blood to the body and tissues. Obviously, that's not the answer you're looking for, so I'll elaborate. There are two types of heart failure. Left side and right-sided, and yes, they coincide precisely with the sides we just talked about. Left-sided results in the left side failing to pump, and right-sided heart failure results in the right side failing to pump. Let's take a look at exactly how this affects a person. In right-sided heart failure, the right side of the heart fails, so let's compare this to construction on a busy street. If there's construction, then it causes cars to slow down, and sometimes they even have to stop. This causes a backup of cars. Depending on the severity of the construction and how long it takes, it will determine on how severe the backup is, and it will influence the cars behind it. The same remains true for the heart, but instead of cars backing up, it's blood and the fluid. If the right side fails, all the blood from behind that point will slow down, i.e. the body. The blood remains in the vessels for a longer period of time, and cells are unable to get rid of their waste and receive the oxygen and nutrients that they need. This leads to a fluid pooling in the extremities, and it causes symptoms known as edema. It's the puffing of tissue due to a collection of fluid in that tissue. This is often seen in the ankles and legs, but it can also occur in other areas like the hands. This is called peripheral congestion. If the left side of the heart fails, the blood from behind that point backs up. The blood that is immediately behind the left side of the heart is the blood coming from the lungs. This causes pulmonary congestion. The backed up fluid has nowhere to go, so it backs up into the person's lungs. With the fluid backup, the person will have difficulty breathing and can often be seen coughing up pink or white frothy sputum. If this is not treated, the person can actually suffocate. The important thing to remember is that when one side of the heart fails, it will put more strain on the other side of the heart, and this leads to total heart failure. Thankfully, there are plenty of treatments to help treat heart failure. Some of them include using a diuretic to remove that excess fluid out of the body. You can also use various drugs to reduce blood pressure, therefore putting less strain on the heart, and using drugs that increase the strength of each heartbeat. Treatment can also go as far as a heart transplant or using mechanical treatment to help repair any damage that's been done. When it comes to health and medicine, the best treatment is always prevention. You can prevent heart failure by living heart-healthy lifestyles and ensuring your blood pressure is in normal range, therefore reducing coronary artery diseases. These diseases can put strain on your heart, thus causing fatigue and failure. Thank you for watching. I hope you enjoyed this video. Please like and subscribe.